Which of the following types of casts are most commonly seen during microscopic examinations of urine? A. Waxy. B. Granular. C. Hyaline. D. Cellular. Answer: C. Hyaline. Drugs classified as which of the following have no prescriptive use? A. Schedule I. B. Schedule II. C. Schedule III. D. Schedule IV. Answer: A. Schedule I. Which of the following terms describes the strength of a drug required to produce the desired effect? A. Tolerance. B. Cumulation. C. Additive action. D. Potency. Answer: D. Potency. Have you had this problem before? Is an example of which of the following types of questions? A. Closed-ended. B. Leading. C. Hypothetical. D. Exploratory. Answer: A. Closed-ended. A deceitful practice undertaken to induce someone to part with something of value is known as A. Invasion of privacy. B. Libel. C. Fraud. D. Defamation. Answer: C. Fraud. Office policy regarding the length of time for retaining patient files should be based on the A. Statute of limitations. B. Number of inactive files. C. Number of active files. D. Availability of storage space. Answer: A. Statute of limitations. Which of the following positions is most appropriate for a patient with hypotension? A. Trendelenburg's. B. Dorsal recumbent. C. Fowler's. D. Supine. Answer: D. Supine. Amounts of salary held out of payroll checks for the purpose of paying government taxes or for employees refers to A. Withholding. B. Net earnings. C. Employee earnings. D. Payroll. Answer: A. Withholding. Which of the following is a write-at-once bookkeeping system? A. Double entry. B. Single entry. C. Pegboard. D. Journal. Answer: C. Pegboard. The abbreviation that means left eye is A. Op. B. OC. C. OU. D. OS. Answer: D. OS. Cyanocobalamin is another name of which of the following vitamins? A. Vitamin B1. B. Vitamin B2. C. Vitamin B9. D. Vitamin B12. Answer: D. Vitamin B12. Retinol, vitamin A, deficiency can cause all of the following, except A. Amenorrhea. B. Infection. C. Night blindness. D. Xerophthalmia. Answer: A. Amenorrhea. Encouraging patients to think through and answer their own questions and concerns is a technique called A. Restating. B. Reassuring. C. Reflecting. D. Rapport. Answer: C. Reflecting. The best description of the term erythropoietin is A. A hormone that stimulates red blood cell formation. B. A disorder that causes an abnormal decrease of red blood cells. C. A disorder that causes redness of the skin. D. Abnormal shape of red blood cells. Answer: A. A hormone that stimulates red blood cell formation. Which of the following is a licensed ambulatory healthcare worker? A. Phlebotomist. B. Nurse practitioner. C. Medical assistant. D. Cytotechnologist. Answer: B. Nurse practitioner. Which of the following terms means administering medication via a route other than the alimentary canal? A. Pectoral. B. Popliteal. C. Paramesial. D. Parenteral. Answer: D. Parenteral. A group of bacteria considered to be the smallest free-living organisms is known as A. Rickettsia, B. Chlamydia, C. Mycobacteria, D. Mycoplasma. Answer, D. Mycoplasma. Which of the following instruments is used to examine a patient's blood pressure? A. Spirometer, B. Sphygmomanometer, C. Ophthalmoscope, D. Otoscope. Answer, B. Sphygmomanometer. In the chain of infection, a person with a compromised immune system would be which of the following links? A. Portal of entry, B. Means of transmission, C. Infectious agent, D. Susceptible host. Answer, D. Susceptible host. The patient history and physical report begins with which of the following types of information? A. Review of systems, B. Present illness, C. Allergies, D. Chief complaint. Answer, D. Chief complaint. The matter speaks for itself is communicated as A. Residential ipsa loquitur, B. Quid pro quo, C. Residential judicata, D. Respondeat superior. Answer, A. Residential ipsa loquitur. Which of the following information should be excluded from a resume? A. Names of references, B. Professional licenses or certification, C. Extracurricular activities, D. Foreign language abilities. Answer, A. Names of references. Which of the following is governed by the Uniform Anatomical Gift Act? A. Blood transfusions, B. Medical experimentation, C. Organ donations, D. Death certificates. Answer, C. Organ donations. The physician has agreed to accept a new patient. A contract will exist when the patient A. Calls for information about the practice, B. Provides medical records from her previous physician, C. Is examined by the physician, D. Arrives at the office. Answer, C. Is examined by the physician. Which of the following types of medical insurance is an example of fee-for-service? A. Medicare Part D, B. Medicare Part A, C. Medicaid, D. Blue Cross Blue Shield. Answer, D. Blue Cross Blue Shield. Which of the following radiographic records is obtained after a contrast medium is injected into a patient's joint? A. Myelogram, B. Cytogram, C. Histogram, D. Arthrogram. Answer, D. Arthrogram. In modified block style, all lines begin where, with the exception of the date line, complementary closing, and keyed signature? A. In the center, B. At the left margin, C. At the right margin, D. At a justified position. Answer, B. At the left margin. Which of the following is the primary purpose of a computer password? A. To store information, B. To start and shut down the computer, C. To prevent unauthorized access to data, D. To back up computer files. Answer, C. To prevent unauthorized access to data. Which of the following types of drugs is used as an anticoagulant? A. Xylocaine, B. Dilantin, C. Zocor, D. Coumadin. Answer, D. Coumadin. The suffix rexus means A. Repair, B. Rupture, C. Stasis, D. Nose. Answer, B. Rupture. A vacutainer tube with which of the following colored stoppers contains no additives? A. Green, B. Red, C. Yellow, D. Blue. Answer, B. Red. The difference between systolic and diastolic pressure is referred to as A. Pulse pressure. B. Pulse deficit. C. Bounding pulse. D. Unequal pressure. Answer A. Pulse pressure. In the term erythrostenosis, the suffix stenosis means A. Softening. B. Narrowing. C. Resembling. D. Enlarging. Answer B. Narrowing. Which of the following terms refers to the rule and principles of conduct that are required of citizens by legislative enactments? A. Philosophy. B. Morals. C. Ethics. D. Laws. Answer D. Laws. Which of the following is included in a memorandum? A. Signature. B. Salutation. C. Subject line. D. Inside address. Answer C. Subject line. Who believed that the basic needs of humans must be met before upper-level functioning can occur? A. Maslow. B. Kubler-Ross. C. Piaget. D. Salk. Answer A. Maslow. Which of the following medical terms describes the surgical formation of a temporary opening in a joint for drainage purposes? A. Arthrotomy. B. Arthroscopy. C. Arthrostomy. D. Arthrectomy. Answer C. Arthrostomy. Which of the following topics is included in an office procedures manual? A. Paid holiday and vacation time. B. Documentation requirements for patient care. C. Annual employment evaluations. D. Performance expectations based on job description. Answer D. Performance expectations based on job description. Which of the following is the most appropriate turnaround time for payment of an account? A. 7 days. B. 15 days. C. 30 days. D. 60 days. Answer C. 30 days. Which of the following foods is chemically broken down by saliva? A. Nucleic acids. B. Proteins. C. Carbohydrates. D. Lipids. Answer C. Carbohydrates. Which of the following is the causative agent of candidiasis? A. Virus. B. Protozoa. C. Yeast. D. Bacteria. Answer C. Yeast. Which of the following suffixes means to crush? A. Tripsy. B. Tropic. C. Tresia. D. Tomy. Answer A. Tripsy. The current procedural terminology, CPT, coding system is based on a main number with how many digits? A. 3. B. 4. C. 5. D. 6. Answer C. 5. Which of the following shows the state of finances of a business? A. Balance sheet. B. Trial balance. C. Day sheet. D. Patient ledger. Answer B. Trial balance. Which of the following computer terms is defined as an accumulation of data to be processed? A. Interface. B. Menu. C. Memory. D. Batch. Answer D. Batch. The most widely used filing system for medical practices is called A. Chronological filing. B. Alphanumerical filing. C. Subject filing. D. Color-coded filing. Answer C. Subject filing. Stretching of the stomach is called A. Gastritis. B. Stomatitis. C. Splenomegaly. D. Gastrictasia. Answer D. Gastrictasia. When performing a hemoccult test, which color is a positive indicator of blood? A. Green. B. Yellow. C. Orange. D. Blue. Answer, D. Blue. Which of the following terms means preparing items for filing by removing loose pieces of tape or paper clips? A. Indexing. B. Annotating. C. Sorting. D. Coding. Answer, C. Sorting. The need for increasing doses of medication to maintain the desired therapeutic effect is a result of A. Synergism. B. Cumulative action. C. Tolerance. D. Trigger action. Answer, C. Tolerance.